to another episode of Dying in Grace. Our program aims to explore end-of-life issues and healthy aging so that we can all be more comfortable for ourselves, for our families, and for our friends. Each week, my name is Arlene Stepputat, and each week I like to invite a community expert to share with us some knowledge. And this week I'm delighted to invite my friend Joanne Deck, who's the manager of volunteers at VNA Health, to talk with us. So welcome, Joanne.
Thank you. I'm pleased to be here. Thank you for having me.
Well, we're really excited to learn about what volunteers can do for VNA Health. But before I do that, I wanted to ask you have an MBA.
I do.
And also the other initials are SPHR. Could you tell us what that stands for?
Sure. That's not well known. SPHR stands for Senior Professional Human Resources. And it's a certification that HR folks get to indicate their achievement. And so I got it years ago, and it just signifies that I have a certain level of HR knowledge, and that's my degree is in human resources. That was my specialty. So it's a great background to have.
Well, yeah, because certainly working with volunteers, you have to know all the nuances of HR. I mean, plus they don't get any benefits or paychecks, so you have to find other incentives to pull them in.
Well, thankfully, HR people are taught about rewards and recognition, and that's a big part of volunteering as well, managing volunteers. But the recruitment, the training, the placement, all of that is really HR related. So it's been a terrific background for me to have in this role.
Well, that's great. And we just want to say you're with VNA Health, but people in our community may not realize that same organization, who's been here more than 100 years, was formerly known as Visiting Nurse and Hospice Care.
That's right.
So under the auspices of VNA Health, you manage the volunteers, and the volunteers you manage are usually primarily for hospice. Is that accurate?
That's the bulk of our volunteers. We have volunteers in every aspect of our business, but far fewer outside of hospice. Hospice is what mandates. We have to have volunteers to have a hospice program under Medicare.
So unlike Hospice of Santa Barbara, which is a voluntary hospice that does have volunteers, VNA Health is a Medicare certified hospice. So you have to follow federal guidelines, right?
That's right. So we have to meet Medicare standards, and one of them is that at least 5% of the services we provide patients are provided by volunteers. So it's important for us to recruit a certain number of volunteers, train them, place them, make sure that they're seeing patients enough that we provide at least 5%. It's simple math, and my math degree comes in well here, calculating that, where are we with that 5%, so that we have enough hours to meet that requirement.
Right, because I think Medicare monitors a whole bunch of things about how any hospice runs, but there's a lot of conditions that your volunteer program has to follow. But let's just, in talking about some of those things, tell me a little bit about being a hospice volunteer. What does it take? Because I think a lot of people hear hospice and think, oh my God, I could never do it. So
there's
two
main things come to mind. One thing is we treat volunteers. Medicare requires that we treat volunteers as unpaid staff. So it takes a willingness to jump through all the hoops that employees have to. You know, for me to be hired there, I needed a drug screen, 2 TB tests, a physical, a background check. So volunteers have to pass all those. They have to be willing to take all those, even though we pay for them. That's one thing, is just making it through. And then, of course, extensive training. Mm-hmm. The other thing is the person themselves and what they bring and the qualities, and I think maybe that's what you were addressing. But it's twofold, because I've had wonderful people who said, I just can't deal with all those requirements, and I've had other people who perhaps don't have some of the softer skills.
Right. So it's that fine balance, and again, I think anybody that's familiar with the government understands there's many hoops that are set up that you just have to jump through the hoops to get where you want to go. It's not like you're imposing some of those standards, but I think it's great that the view screen is that volunteers are as good as, are as important as, are viewed as as integral as the paid employees.
Absolutely. We have what's called the circle of care, and in the center is the patient and the family or caregivers, and then all the other roles on the team, we have a team approach to care, are indicated, and one of those roles is the volunteer. The volunteers need to have excellent listening skills. They, of course, need to be able to talk about and just face death. They are just in the process that at some point they're going to lose their patient, probably through death. Once in a while, there are the reasons why that relationship may end, but they have to be ready to know that's going to happen, to be in an environment where family are losing a loved one, having a lot of loss, and being able to deal with that. So to have lived, certainly, to have had some experience in loss, but not have it be so close and so fresh that it brings up too much when they're there. So that's the thing.
So if somebody had, because I think, and I've heard this from people in the past, that they were well served by hospice, and maybe, it's 3 months or 6 months after their loved one has passed, and they feel like now they want to give back. And they come to you and say, I want to volunteer with patients. What do you do?
Our general rule is a year. We look for a year because you want to go through the whole calendar year. With anything, when you're adapting to something new and a change, you think about the things that go on in an annual cycle. It's best to go through a whole year without your loved one and get through that process. So that's where I think the year comes from. If someone really says, I'm ready now, I'm sooner, or perhaps it's even more than a year, but we're not sure, we can send them to our bereavement staff. We set up an appointment with our bereavement counselor, and they help us make the assessment. Is this person ready?
Right, because you're dealing with people at a very tender point in a patient's life, in a family's life, and I really appreciate that, making sure that the person who wants to volunteer is also ready to do this, because it's tender on all parts.
It is, and things come up. I was just chatting at an interview today with a young person. He was telling me about his grandfather dying and the process he went through. And he brought up all kinds of memories that I had of my grandmother's death when I was in college. And so I was telling him, this is exactly what will happen when you're with a patient, and you want to be able to have those memories come up and not have it really devastate you. So you have to get to a point where you're healed enough through your own grief enough, because things will come up. There are times when you can't help but have something really trigger a memory of a close loss for yourself, but you want to be able to maintain your composure and be that support to the family, because that's what you're there for. They look to you for that. The volunteers play a role that no one else on the team does. And that's the sweet thing about hospice volunteering, is the volunteer comes with no agenda. They're not there to do anything medical, to do any assessment, poking, that kind. They come in, they don't have a mask on, they don't have the
a computer
scrubs on, right. They're just there because they want to be there. And they're there to listen, to be a companion, to be a support for that patient and for the caregivers.
So when a volunteer visits a patient, I've been around hospice enough to know that because, as you say, other team members have tasks to perform, so they're there for 20 minutes or whatever. What is it, how long do you ask volunteers to stay for? What's a typical visit, or what's the expectations? If I wanted to volunteer with a patient, what's my time commitment?
It really varies. I would say anyway, I use an hour and a half is common, but it can be less. The patient, I was visiting a woman, she got tired, she would tell me when it was time. And that, I hear that's very common with our volunteers will report that. They tell me when it's time to go. So it may be a shorter visit than that if the patient is tired, has something that they're doing next. They have schedules. So it may be, and on the other hand, if it's a respite visit, the other thing that volunteers do, in addition to being a companion, is to provide the caregiver respite. So at that point, they're there to keep the patient, make sure the patient's safe, so that the caregiver can go out, maybe go to their own doctor's appointment, or have lunch, or just do what they need to do, shop, whatever they need to do.
So they're providing a break. So the caregiver gets a chance to
Right.
just live a normal life knowing the person they love is well attended to and is safe.
Exactly. So those visits tend to be a little bit longer because by the time the person leaves, does whatever they're going to do and comes back, those visits tend to be more like 2, maybe 3 hours, although 3 hours is a long visit. They do happen. We let our volunteers tell us what they can and can't do. Some volunteers, that's fine for them. And they'll make that weekly visit and they know that that's what they're going to do and that's fine. Others have different parameters and that we just make the assignment based on what they can do.
So I'm aware that your program also has, besides the companion and friendly visitor part or respite, you have some special programs that are unique and people can participate if they come with certain things. So could you tell us, for instance, I know you have a program for veterans. Could you talk a little bit about that, you know?
We are part of the We Honor Vets program, which is a partnership with the Veterans Administration and the National NH, the National Hospice and Palliative Care Organization partnered, I always have to say those initials out, to show our veteran patients the respect, the gratitude that they deserve. And so the two organizations created this program and created different levels of participation. And VNA Health is a level 4, which means we do a number of things for veterans involving volunteers. We have vet-to-vet assignments, probably the most popular. We recruit veterans to be hospice volunteers. They go through the entire training program, and then they're placed with, partnered with a patient who's a veteran. And they share stories and photographs, and it's just a wonderful way for the veteran patient to connect and perhaps talk about things that they never have had a chance to. And another thing our veteran volunteers do are veteran pinnings, where sometimes the family initiates a pinning ceremony and sometimes it's the patient. And so the veteran volunteer will come with a pin indicating the service, what branch of the military the veteran was in. And we have the Quilters Guild in Santa Barbara gifted us wonderful dozens and dozens of military-themed quilts. And so we're presented with a quilt, we make a certificate, and then there can be a very simple ceremony, 10 minutes, we take photographs if they allow it, or it can be much longer. Family can come, stories are told, and sometimes the kids, the young people have never heard their stories. They had no idea what Grandpa did or what Dad did. And so it's a wonderful way for that veteran to share those stories.
And I think some of the veterans on hospice, I mean, most people are a lot older, so it could easily be, you know, what they did when they were 20 or 25 and now they're 75 or 80 or 85, you know, that gets lost in the mix. So what you're saying is that children might discover something that, Grandpa, you were in World War II?
Exactly.
You know, and
we're at a place right now where we are really losing the last of our World War II vets.
Yeah, yeah. So I would imagine you're starting to see Korea, Vietnam, certainly with the boomers booming and all the, you know, some of the disease elements that came in with Agent Orange and those kinds of things. You're seeing some of that,
right,
you know.
exactly.
So, well, that's wonderful. So that means you need veterans who are volunteers, or you know, looking for them to offer that specific service.
That's right.
What other kinds of programs or offerings do you have for volunteers?
One of our most popular with patients is our pet therapy program. And so we have primarily dogs, although we do have a cat right now that is paired with a human. So we have pet therapy teams that go and visit patients. They'll go to our inpatient hospice facility, which is Serenity House, or they'll go to patient homes. And so when the social worker is typically the one who makes assesses the patient's needs and will hear, oh, he loves dogs, oh, he misses his cat. And that will trigger the social worker to say, well, we've got a pet therapy program. And so our pet therapists are wonderful because, Arlene, they not only have to have their animals certified by certifying bodies such as Love on a Leash or Therapy Dogs International, they themselves then have to go through volunteer training. So all of those steps that I was mentioning, all those assessments and screenings and the 24 hours of training, they have to have. So it's a huge commitment for a pet therapy team to come. And we treasure them, and they just bring such joy to our patients. We hear it all the time.
Well, as an animal lover myself, I would love a dog. I just saw a cartoon today, or a birthday card, and it said "Death by Puppies," and I just fill my bed with puppies. That would be a nice way to go out.
Exactly.
I wouldn't mind, those licks and cute little faces. That would work just fine for me,
Yep.
So, what other programs? Let me ask you, Joanne. What if someone says to you, I really want to help, but I don't know if I could be around the people who are dying. How can I help VNA Health? I'm not sure I'm ready to do that other stuff. Are there options for those folks?
There are. One of the things we do is deliver flowers. And so VNA Health partners with the Dream Foundation. And every Saturday we have a team of volunteers that will go to Dream Foundation, which has its own team of volunteers making bouquets. Mm-hmm. So flowers are donated, they make bouquets, our volunteers go pick them up, and they may deliver flowers for anywhere from 3 to 6 patients. And they just bring that bouquet. It's if the patient is new on our service, or if that coming week they're having a birthday or a special anniversary, we bring them flowers, and they don't expect them. They have no idea they're coming, and again, such joy. And it's also a treat for the family. Mm-hmm. And I've delivered flowers, so I can tell you that they love to get that bouquet, and sometimes the volunteer will go in and chat with the volunteer or the patient and the family, or they can just drop them off. Mm-hmm. So that's an easy way for a volunteer to get started. Uh-huh. It's just pretty much joyful. It's just a really fun thing to do, and there's not a lot of interaction, so it's a way to just get started and see how it feels for you.
Well, I think one thing that people have to realize about hospice is that you can be on hospice for quite a long time. So, I think we see often people thinking hospice, you're at death's door, you got 2-3 days, maybe, something like that. And the truth is that people can be on hospice early in once they have a prognosis of 6 months or less, but they can be on hospice for quite some time. So there is a chance, like for a volunteer, to create a relationship with someone, I would think.
Absolutely.
Because it lasts longer. And so it's not always you're seeing this person and they are, in bed and actively dying. That's not your experience. It's more people wanting to enjoy the last parts of their life. And so
that's right. So that companionship and the conversation. And
right.
So often the volunteer will be with someone for months. We've had them stay as long as 2 years. And
wow.
That's on the outside, but certainly 3 to 6 to 9 months is not at all unusual.
See, and I think that's an important message for our viewers, because I still think the stereotype is hospice, you probably got 10 days, and that's really not the case more often than not.
It's so sad for us when we see that, because we pretty much figured they could have had help. They would have qualified for help a whole lot sooner, and it would have been so much easier for the caregivers and for the patient to have had all those wonderful hospice services, the equipment, the medication, all the staff.
Right.
Really makes a difference. And I think that's what helps some people live longer, actually, is getting on hospice.
Yeah.
And having some of that support gives them the opportunity to stretch their life out. And as long as there's a decline, they can stay on our service.
Right, but they can live well in those,
absolutely.
Those last however long they have. So you mentioned earlier that you do volunteer training. What does that entail?
Training happens twice a year. We have classes in the fall and spring. They're 6 weeks long, once a week. Right now, we offer them on Tuesday afternoons. And so for 6 weeks in a row, volunteer trainees come in, and we take them through everything they need to know, from what is hospice care, where do they fit on the team, what are the Medicare requirements, what can they and can't they do as a volunteer, communication skills, interpersonal skills, how to deal with someone with Alzheimer's, what is up with veterans. It just, when you think about it, the training is very elaborate. So they are well equipped to go and work with that patient.
So it sounds like it's pretty intense. So what if I can't come on Tuesday afternoons?
We also have throughout the year a self-study option. And so those volunteers look at some videos online and do some quizzes and then come in and meet with us personally and get the pieces that they didn't get. The videos are Hospice 101, if you will. And then they come in and work and learn more about VNA Health and our marketplace and us and how they fit in with us. And so we catch them up that way.
So, you know, working with death and dying can take its toll on anybody. So how do you help the volunteers continue on with the work, particularly, you know, maybe after a patient that they cared for died, or just how do you help them sustain themselves in the commitment?
It's an excellent point, because self-care is so important. So in the interview, we ask them what they do, and we talk about what the need to take care of themselves and how caregivers, the demand on them is so great. And yes, that's why their role as a volunteer is important, but they're also a caregiver in that volunteer role, so they need to care for themselves. So we start that message before they even sign on the dotted line, if you will. And then from there, we do a number of things. We have a monthly support group that meets. We meet with the volunteers, come together and share their successes, their challenges, their stories. I am always amazed by that meeting. It's one of my most favorite things in my job, is to have that support meeting. And all I do is just bring people together and facilitate it. They bring up topics and talk and really have a lot of support from that. So we do that. We have quarterly training for volunteers. So we bring in speakers on different topics that are relevant to them, things in self-care. We also offer, again, reminding them that our bereavement services are available to anyone in the community. VNA Health, bereavement, anybody can take advantage of those services, not just our patients. So certainly our employees and our volunteers can as well. And so we'll encourage that if they've had a loss. And sometimes they have losses not just with our patients, but in their private lives. A family member, neighbor, colleague, and we try to stay close with them and suggest they take a break. And do some of that self-care, take care of themselves, and then come back to us when they're ready.
So it sounds like in your job you have a lot of nurturing of the nurturers, if you will. I mean, keeping tabs on folks. About how many volunteers are you overseeing at any given time?
Right now we have about 130 volunteers.
Wow, that's a lot of people. And I think VNA Health isn't just in Santa Barbara, right? We have locations.
That's right.
You serve the whole county, don't you?
The whole county. So we have about 25 patients in the Solvang and Lompoc area, and we have a couple even as far up as Santa Maria.
Wow. And you also mentioned Serenity House. Do you use volunteers over there?
We do. About a third of our patient care volunteers, work volunteer at Serenity House, and so they'll perform a number of tasks. The most common is to sit with patients, to be there at different times. And a lot of times when patients get in to Serenity House, you know, they're in new surroundings, they're unsettled. Having a volunteer come and just be able to sit with them. Now, staff are running in, they're doing all kinds of different things to get them settled, get their medicines and their belongings and everything settled. The volunteer can just come and be peaceful and sit and just give them that comfort of, I'm here and all is well. And I'm going to just keep you company until you get acclimated. So they perform those kinds of services. And then just throughout the day or the patient's stay, different volunteers will come. Volunteers do other things there as well, though, depending on what's going on at that time, at the time that they're there, and what the census is. They might sit at the front desk, they might do some laundry, pass out meal trays, greet visitors. So they perform a variety of duties. And we're 24/7, so volunteers there can come in after work. So a full-time person could volunteer at Serenity House. They could come on a weekend. And that can be a really nice time to see patients. It's a little bit quieter, not as many staff on, and so the volunteer can go and really visit with people. It's a great time to go.
So how would somebody start the process? Hopefully some of our viewers are saying, you know, maybe I could be a hospice volunteer. How would they get started? What's the plan for them? What do they do?
The easiest thing to do is go to our website, vna.health, and click on the volunteering tab, and then different drop-down options will come, and the patient care volunteer will explain so many different roles that I've been talking about, the requirements, the benefits, just the self-knowledge that people get from volunteering and facing their own mortality and being with others who are facing theirs is so deep and rich. So they read about that, and then at the bottom is a link for the application. So then they apply online. I know immediately, the system triggers me when they've applied, and then I'll call and we'll have an interview, just like a job. We'll interview and get to know each other better and see what the requirements are and how they feel about it. And then we decide which option of training fits best and move forward.
So for folks that are not people, but they still want to help because they value what VNA offers, are there like office jobs or clerical jobs or other ways where you don't have to go see those people, but there's things that you can do?
Yes, we have administrative volunteers in a number of departments who are helping with, we have a bereavement mailing team because Medicare requires that we stay in touch with the family after the loved one has passed, and so each quarter for the first year we send a mailing. So we have a team of volunteers who put those mailings together. They work in different departments also, business development, home health. We have volunteers in our loan closet. Our loan closet is a wonderful service we provide the community where community members can go and get wheelchairs, walkers, different equipment. And so volunteers provide a lot of the support there.
So what I'm hearing, Joanne, is whether you're feeling like you want to work at the bedside, maybe with someone very close to death like Serenity House, or companion people, or bring your trained certified animal, or you're a veteran, there's lots of options.
There are. And one last pitch, we're recruiting always and Lompoc.
Okay. Well, thank you so much, Joanne. We're so happy you're here. And I'd like to thank Michael Nicholson and Elliot Jacobson, our team, and TVSB for allowing us to do this program. And we want to thank you, our viewers. You can watch previous episodes on YouTube, Dying in Grace, or dyingingrace.com. And Joanne, we have the Book of Living Love, where we invite you to put the name of someone that you have loved and lost in our book, because to live in hearts we leave behind is not to die. So you're invited to do that if you'd like.
Thank you, Arlene.
Yeah, it's great.